let me know that they do the procedure every day, do several of them every day, and that it was not uncommon for somebody my age, not just someone that was older or had children. So he was very knowledgeable and, was very confident in telling me exactly how the procedure would work and how it would heal. I thought with having the leakage, the only alternative would be bladder surgery, and I'd always heard how painful bladder surgery was. But once coming up here and talking to Dr. Harris, he explained that there was alternatives to that, and so the recovery time and the pain from the bladder sling was nothing compared to what I thought that it was going to be. And then I came in for outpatient surgery, and I came in about 7 o'clock that morning, and I was back going home. I was on the road going home by noon. It's like about a 30-minute procedure. They do put you to sleep, but there was no problems whatsoever. Dr. Harris had given me a prescription for some painkillers, but I didn't feel it, and I just had a little minimal pressure, and I took Advil, and then the next day I had just less pressure, and by 2 days after the procedure there was no pain whatsoever. He did caution me for about 2 weeks not to lift anything over 10 pounds, but I was back doing everything, just a little cautious with it. And then within 2 weeks, I was back normal. And you're still a little cautious at first because you've had this problem for so long, but then you just kind of forget about it, and everyday life is back to normal. The problem with the leakage was that you were conscious of it, that if you knew you had to sneeze, you would stop to make sure that you were aware of your surroundings. You were all the time having to wear some type of a liner or something to prevent leakage into your clothes, and it just made you aware of your surroundings, and to know that you didn't want to go very long without getting being able to stop at a restroom somewhere. I had tried medicine for the leakage in the past, and the side effects of it were the dry mouth, and it was extremely hard to talk with the dry mouth, even though you were drinking lots of water. Then that overrode the trying to take the medicine to dry up the leakage. I was referred to Dr. Harris and came up here to do a test to see exactly what was causing my leakage. And the first time I came in and met Dr. Harris, he was very nice. He made me feel very comfortable, and they did the procedure here in the office, the testing in the office, to see where the leakage was coming from. He was very knowledgeable and explained exactly what he was doing and how my problem was causing the leakage. The quality of life is so much better now, as then you can exercise freely, you can walk, you can sneeze, you can cough, and you don't think twice about it. You go on about everyday life as everyone else does, and you don't even think about it anymore. If someone came to me and talks about that they had the similar symptoms that I did, I would refer them up to this clinic, because the procedure, like I said, is very minimal. Recovery time is short. There's no hospital stay, and it makes life so much better, and it's well worth it.